We all get abdominal pain now and then, but some symptoms are more serious and require more medical attention. So what do you do? What do you watch out for and do if you have serious symptoms? Dr. Brian Long is a minimally invasive abdominal surgeon with the Nicholson Clinic for Weight Loss Surgery and has all of the answers. Welcome. Larry, our floor director, said he's definitely going to be watching this segment, so as are a lot of people. I know that the Nicholson Clinic specializes in weight loss surgery, but you also focus on other abdominal health issues. Why both?
Right. Well, all of the surgeons at the Nicholson Clinic are board certified with advanced training and expertise in both general abdominal surgery and weight loss surgery. And many of the common abdominal health issues in all patients are actually even more common in obese patients. So we have a special interest in those things.
So what surgeries do you perform?
The ones we're referring to are gallbladder surgery, surgery to treat acid reflux, and repair of abdominal wall hernias.
Okay, how common is gallbladder disease? I don't think of that as being incredibly common.
It is very common. In fact, gallbladder surgery is one of the most common surgeries in the U.S.
Really?
Where nearly 500,000 procedures are done every year.
Did not know that.
Right.
Would not have ever thought of that. So what are the symptoms and how do you treat it?
Sure. So your gallbladder is a small organ on the right side under your rib cage, and it helps with digestion. Gallbladder disease, usually due to gallstones, tends to present as upper abdominal pain, often on that right side. The pain tends to radiate through to the back. Some associated symptoms include nausea, bloating, sometimes vomiting, and the pain's often after eating greasy, fatty meals. Now, the treatment for gallbladder problems is surgery to remove the gallbladder, and it's a laparoscopic or minimally invasive procedure. Takes about 30 to 40 minutes. Patients go home the same day, generally back to work within a few days.
Okay, I think this is what Larry was curious about. How common is reflux, and what are the signs that it's a serious problem?
Sure. Acid reflux is also very common. In fact, all of us probably experience acid reflux at some point in our lives, though it's usually mild and infrequent. However, there are a portion of patients that have more significant symptoms, and that's what we refer to as gastroesophageal reflux disease. The most common symptoms are heartburn, which is a burning in the upper abdomen or chest. Other symptoms can be cough, hoarseness, and what's happening is acid from the stomach is refluxing back up into the esophagus. The treatment for that, there are several different ways to treat that. The first line is diet and lifestyle modification. After that, we have a host of medications, both over-the-counter and prescription. And then for patients where that's not really as effective, we do have surgery, which again is a minimally invasive or outpatient procedure. Takes about less than an hour, and patients again back to work usually within a few days.
Okay, and as you can see, Larry, our floor director, is listening intently over there. Was that what you wanted to know, Larry? Okay, you answered his question. All right, let's talk about hernias for just a second. What about hernias? What types are there? What can you tell us about that?
Sure. What we're talking about are abdominal wall hernias, and a hernia is basically a hole or a defect in the abdominal wall muscle. The more common locations tend to be the groin, the belly button, or at the location of a prior incision. And hernias present generally as a bulge in the abdominal wall or with some pain. And the treatment for that is also a minimally invasive procedure, typically, often outpatient procedure to repair that hole and to relieve the pain and avoid complications.
The thing about it is, with any of these, it's really important not to ignore the symptoms, right?
Correct. The symptoms generally start as mild, but can progress and become quite severe. For example, gallbladder disease can progress to severe infections of the gallbladder requiring emergency surgery. Acid reflux disease, if it goes untreated for a long period of time, can even lead to esophageal cancer. And hernias, if they're not treated promptly, there's a rare risk of them progressing to abdominal or intestinal injury and emergency surgery. And
all things that treated appropriately and quickly are pretty easily treatable, right?
Absolutely right.
All right. Thank you so much for coming in. Appreciate it. The Nicholson Clinic for Weight Loss Surgery is in Dallas and in Plano. You can call 972-494-3100 for more information, or just simply go to nicholsonclinic.com, click on the abdominal surgery link for videos and for more information.
Amped Up, sponsored by the Nicholson Clinic. This is the year you lose the weight and change your life. Call the Nicholson Clinic today.